And we are live on my YouTube channel now. This is my baby brother and Cappy. Hi, Cappy. He's really sleepy right now, and he's always sleepy anyways. Hi, people. I know nobody's watching nobody's ever watching my live video. Oh no. Are you guys there? Hello people. Anyways, let's start with this video. I'm going to just upload it on YouTube anyways, because this is something that is asked about my husband and when he passed a lot of times as well. So I just deemed it necessary for me to address this issue. And what is Marfan syndrome? If none of you know about this disease, which not a lot of people are aware of, it is a genetic disorder of the connective tissue. So what is a connective tissue? We are made up of basically made up of super many connective tissues. All right, so I'm just reading it off of Wikipedia. I'm live right now, Mom. You want to say hi to my subscribers on YouTube? Come here. Come here. Hi. That's my mom. It's my mom. You're live right now. I'm not gonna edit this. Okay. Anyways, let me talk about Marfan syndrome. It is a genetic disorder of the connective tissues, as I've said. The degree to which people are affected varies, and people with Marfan tend to be tall, thin, with long arms and legs, fingers, and toes, and they also typically have flexible joints. And my husband, which he was 6'8", actually had really flexible body that he would be doing the splits in our house, and he was really long, so he would take up so much space that, oh my gosh. And this is live. I'm sorry, whoever's watching me right now. I'm sorry. I'm having technical difficulties. Whoop. Sorry. All right, I'm back. So he would do the splits, and he would actually take the whole house because of his long limbs. But let's continue with what they say on Wikipedia. And people with, okay, blah, blah, blah. They also have flexible joints and scoliosis. Yeah. The most serious complications involve the heart and aorta, with an increased risk of mitral valve prolapse and aortic aneurysm, which is unfortunately what took my husband's life. I was getting really emotional today. We went to a party, a Filipino party, and I couldn't hold up because it was just really weird that I'm in a party, and he liked Filipinos a lot, and he liked going to parties, birthday parties like that, because he can eat a lot. But it was just really weird, and I was getting emotional. So I came home and I decided to do my live video. And anyways, other commonly affected areas include the lungs, the eyes, bones, and covering of the spinal cord. Okay, and it is an autosomal dominant disorder. But let me just look up what autosomal means. Okay, let me look it up for you. Autosomal, what does it mean? It doesn't really give me a quick lookup of what it means, but you can look it up if you want to as well. About 75% of the time, the condition is inherited from a parent, well, 25% of the time is a new mutation, which is really weird, and nobody knows where it comes from too. It's so weird. Like, in this day and age, Mom, in this day and age, we still don't know where it came from. And it also involves a mutation to that gene that makes fibrillin, which result in abnormal connective tissue. Diagnosis is often based on the gen criteria, and there is no cure for sorry, I was gonna say Marcus syndrome, Marfan syndrome, and many people have a normal life expectancy with proper treatment. I was talking about this a while ago, and my husband's dad, my father-in-law, actually have the syndrome, and he's around 60, and he's good. He's pretty much well, and he takes care of himself, so it's good. It's a good thing. And they have normal life expectancy with proper treatment. Although I've read in another medical document that normally Marfan's patients actually have at least around 30. They pass around 32 or something. He didn't actually meet that because he passed when he was 29. Management often includes the use of beta blockers. He had maintenance for sure. He had warfarin, which is to prevent any blood clots, because it thins your blood. Because any blood clot, a little bit of blood clot, because he had aortic valve replacement, would kill him. Could have killed him, but alas, that's not the one that killed him. He had beta blockers, which was bisoprolol, and he had carvedilol too at some point, and he hated that. Oh, he hated atenolol worse. That was the worst for him, he said. Surgery may be required to repair the aorta or replace a heart valve. So he had an aortic valve replacement when he was 20 years old, and he survived that surgery. But unfortunately, 9 years after that, around 10 years, he didn't survive the aortic aneurysm, the dissection, or aneurysm was what killed him, together with the cardiac arrest. And anyways, it is recommended that hard exercise will be avoided, and of course you can't lift weights because that stresses your heart muscles and stuff like that. He didn't do that. Since he was 6'8", he always had this burden in his heart. Like, he really wanted to play for the NBA, and he could have, because he was really talented, but unfortunately he couldn't. I don't know if you guys are aware of this, but there is an NBA player. He was drafted to play in the NBA already, but then he got diagnosed with Marfan syndrome, and he didn't know this before. I forgot his name. But let me look him up. Let me just look him up. Player with Marfan syndrome. What's your name? Isaiah Austin. Yeah, Isaiah Austin. So I think he's still playing in Europe now. I'm not sure, but it's Isaiah Austin, and he had been diagnosed with Marfan syndrome on his first year when he got drafted for the NBA. So that kind of sucks for him, but he's still playing, which is not recommended. If you actually have Marfan syndrome, I wouldn't recommend you playing basketball. It's a contact sport. You'll die. Okay. There is no cure for Marfan syndrome. Yes, there is no cure for Marfan syndrome, but there are treatment. More than 30 different signs and symptoms are variably associated with Marfan syndrome. The prominent one of these would be the skeletal, cardiovascular, and ocular systems. So let's talk about the skeletal system. So basically, they have abnormal, abnormal, above average height, and some have disproportionately long, slender limbs with thin, weak wrists and long fingers and toes. He would be able to bend his finger over up until his like, what is this bone or whatever. He would be able to actually bend it over. It was freaky. It was kind of freaky what he was doing with himself. But anyways, yeah, so they have curvature of the spine, thoracic lordosis, abnormal indentation. So like you can see sometimes you would be able to see like indentation in their chest cavity. You would see that it looks really weird. Their ribs look really weird sometimes. Flat feet, hammer toes, stooped shoulders, and unexplained stretch marks on the skin. Mom, do you remember? You noticed that? Yeah. Most Marfan's patients, they have like stretch marks, and Mark had a lot of them, right, Mom?
Yeah.
Yeah. So that I didn't know this before I actually went on Wikipedia and read through this, and it's actually common for people with Marfan syndrome. Apparently, nearsightedness. He had an eye surgery. Strabismus, cross-eyed. Some of them do have that. Myopia, corneal flatness. He had a little bit of lazy eye, and he got that fixed when he was younger. He would get really he would get very anxious and like sensitive about the lazy eye thing, because I used to joke around and he would get really mad. Anyways, of course, the cardiovascular system, which would include fatigue, shortness of breath, heart palpitations, racing heartbeats, or chest pain. And he would get like radiating pain to the back, from his chest to his back. Cold arms, hands, feet. I don't know this, but this is not something that Marcus had. Come here. Clearly he doesn't like me right now. Anyways, abnormal heart murmur, normal reading on their ECG, angina, cystical medical degeneration. Yeah, so blood flow, like the heart is the main thing. This is, I think, the worst thing for people with Marfan syndrome. It's just, it attacks your heart, and it's so horrible. The lungs, pulmonary, you know, it affects your heart, it affects your lungs, nervous system, spinal cord, and can result in the loss of quality of life. Basically, everything in your body is affected. It's not discussed here on Wikipedia, but my husband actually had a really bad case of irritable bowel syndrome. IBS was the worst thing for him. And I read, like, there's an online resource for like a community of people who have Marfan syndrome, and they actually talk about this, like they had surgery and stuff like that, about their colorectal issues and IBS. And I didn't know this before he passed, but it's common in Marfan's patients to have issues in their bowel and like their stomach and all that stuff, excuse me, which is really weird because although when I read through it, it's a connective tissue, right? So it's still connected to your body, and the stomach and your colorectal health is obviously, it affects you too. And before he passed, it was just, it was a nightmare for us going through all the tests and stuff like that, and having to not know what's wrong with him and stuff like that. And we did blood work, thyroid checks, his just going back to that. And it's so frustrating as a wife or as a loved one. Anytime you have a loved one that's really sick, it's so stressful because like you don't know how to help them, right? Like you want to know and get to the bottom of everything, but you don't know how to help them. And it's just so this is my brother. Say hi.
Hi.
It's just so frustrating to not know what to do or how to help them. But we did a battery of tests and stuff like that, and I was so scared. I thought he had cancer at one point. And then like when we got out of the hospital, we got out of the clinic, and they say negative, 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 which is a good thing, but then a bad thing too, because you don't know. You still don't know. Like it's a win situation, because you don't know still what's wrong with him though. Like, okay, he doesn't have cancer, but what's wrong? And then when he passed, I just felt so guilty, because I was like, maybe we missed something. Maybe there was something in his in his tummy that we could have like detected the aneurysm and prevented it. And you just like have that, you just have these mind games with yourself, and like, oh my gosh. And I felt like it was my fault for the longest time. I was like, feel so bad. I'm a bad wife for not being able to stop this from happening. But like, what can you do? You can't do anything. Like, there's no way for you to be able to stop death from happening. Like, here's the thing that I've realized in my life after my husband passed away. Like, you can try to prevent anything and everything from happening from your life, but at the end of it all, somebody has a hold of your life, and you have a deadline or you have an expiry date. This is what my pastor says. Everybody has an expiry date. Okay? So even if you try so hard to not expire, unfortunately, you will one day. And people are just messaging me and stuff, but what I love about my family and the people around me is they're very supportive. Like, I just came from a party a while ago, from a Filipino party. It's a birthday party, and it's so hard. It's difficult for me to be with people that I love and that I share my life with, because like a part of me is gone, and it's so weird to act like everything is normal, because it's not. Like, I'm not the same person. I'm not gonna be the same person that you've known me. If you're watching me and you're one of my friends or one of my family members back home in the Philippines, or you're just a friend from church, or whoever you are, like, if you know me, or if you know someone who experienced a loss in their life, you think you look at them and they're the same. They're not the same. We're not the same. When you're touched by grief, when you're touched by death, no. I'm still finding my new normal. I'm still finding my new Charisse. I'm not the same person as I was 6 months ago when my husband was still alive. I am not a wife anymore. That's the reality of it. I'm a widow. I'm a young widow, and it took me so many months before I realized that this is my reality now. And the longer you prolong that agony in your heart, and that longing in your heart, and that clinging to the past in your heart, it's longer for you to heal. Like, you need to come to a conclusion in your life that, okay, so this happened, but it's not going to pull me down. You have to decide that to yourself, because if you don't decide that to yourself, you won't make it. You really won't. And you need support, and you need love from your family, and you need love from yourself more so. Obviously from God. You need your strength from God, but you need to find it in yourself, within you. All of the strength that you can gather to accept it. And November is hard for me, right? November. Are you watching me right now?
Not right now.
Oh. What are you doing?
I'm trying to curl my hair.
My brother's so weird. November is hard for me because it's our anniversary. And sometimes I feel like I'm okay. Like, I'm normal, as I've said. Like, I'm contradicting myself. There's no such thing as a normal for you if you lose your loved one. But I feel like everything is all going good. Everything is well, blah, 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 blah. But, and then it hits you. Like today, it hit me so hard today. I had to come home again. Like, I can't deal with seeing so many people and just like, and then they ask me so many questions and stuff like that. But at last it happened, and I'm still grieving. I wish I could say that it's easy. I wish that I could say that it's easy for me every day, but it's not. It's like a constant pull from reality and the past and my future and stuff like that. I used to be so scared. I used to be like really scared of the future and stuff like that. I'm not anymore. I'm not scared of anything. Like, honestly, I used to be scared of losing the love of the people I love. But then I realized, like, why should I be scared when I know where they're going? I know where I'm going. And I know for a fact that Marcus was such a good, not just a good person, but a good man. I wish I could say that when people ask me like, oh, you know what, you're young, when people tell me that, it just drives me insane. I don't know if because people ask me all the time, are you ever gonna, have another person in your life and stuff like that, and I just don't see myself being with another person, he was my person, so I can't think, and I can't even imagine anybody filling my husband's position. Filling my... I am moving forward. I'm just taking it a day at a time, but I think I'm done for now. I love my husband and I miss him so much every day, and I miss him. I will be missing him until the day I pass away. It's the reality of it. I love him. And it's November. I get really sentimental and emotional, but I'm hoping I'll get better, because November was our thing, because like I was on a long distance relationship for a while with my husband, and the thing that hurts the most is I only had a year with him as my husband, and then I felt like he was taken away from me for the longest. Sorry. It's hard. It's a constant battle. I don't even have words to describe my feeling and the emotions that go through me every day. It's just not the same anymore. It's not. Food doesn't taste the same way. The places that I go don't look the same. This house doesn't feel the same anymore. That's why I moved out right away from the house that we lived, because it was when he passed, like I told my landlord right away, I'm done. I'm leaving. I'm gonna go to my parents' house. And even this house is hard because most of our weekends we hung out with my family. And this house reminds me so much of him everywhere I look. And when he first came here, we hung out so much with my family. No, I didn't think I would cry, but okay. Give me 1 second. I'll be right back. My parents came from the Philippines, so they bought me this. It's just my favorite. It's called V-Cut. I know, why would they call it like that, right? It's really good. I like it. My favorite chips from the Philippines. Sorry, I got hungry. When I get depressed, I get hungry. I have nephews and family back in the Philippines, and husband will never meet them anymore. It's just, that's what sucks, right? Memories that are, it's just time is passing by you, and it just hits you one day. You're like, oh wow, he's not here anymore to share this with me. But you know what? It's fine. He's in such much better place that I'm good with the fact that he's not suffering anymore. Even though I don't get to keep him here, as long as he's not in pain anymore, I'm okay with that. I'm gonna go eat and watch Stranger Things because I'm really addicted to Stranger Things for some reason. But thank you so much for watching this, or if you're not watching it, thank you for watching it in the future. And I'll see you again on another video. Peace.